name is Dr. Sasson. I'm a surgical oncologist at Stony Brook University Cancer Center. My specialty is complex gastrointestinal malignancies, particularly those of the pancreas and liver. I specialize in a complex operation called the Whipple operation. The Whipple procedure is used to treat cancers in the head of the pancreas. There are other cancers in that area, but pancreas cancer is the most common. The Whipple operation is a complex operation, approximately about 5 to 6 hours, with associated complications, but unfortunately it's the only treatment option that has any chance of curing patients who may have pancreas cancer. The pancreas is about 6 inches long and sits across the back of the abdomen behind the stomach. The head of the pancreas is on the right side of the abdomen and is connected to the duodenum, the first portion of the small intestine, through a small tube called a pancreatic duct. The goal of the procedure is to remove the head of the pancreas, the bile duct, and the surrounding duodenum. It is quite important that the operation be done so that all the tumor is removed. The difficulty is that there are some very important blood vessels next to the pancreas, which sometimes need to be rebuilt, or it could be in the way and could make the operation not possible. All these things require an extreme amount of expertise, as well as knowledge with interpreting CT scans and MRI scans. The best candidate for this procedure is one who is physically fit, has no signs of cancer spread, and whose tumor does not involve the surrounding blood vessels. I often get asked about patients' age. In my experience, about 15% of my patients are over the age of 80. If they are fit for the surgery, then they're a candidate for the surgery as long as their tumor is removable. The number of people on the team for pancreas cancer here is quite immense. It starts off typically with the gastroenterologist, who will evaluate someone because their tumor is compressing the bile duct and they've become jaundiced or they've turned yellow. They will often then place a stent to alleviate the obstruction of the bile, as well as to do a biopsy and diagnose pancreas cancer. Following that, a CT scan is performed, in which we evaluate the extent of the tumor. So additional members of the team, who patients typically or very rarely see, are the pathologist and the radiologist, who play a vital role in both diagnosing their pancreas cancer as well as determining the extent of involvement of the tumor, whether it involves the blood vessels or whether it has spread. Following that, other members of the team would include a surgeon such as myself and my partners, as well as medical oncology and radiation oncology. We all work together to discuss our patients to provide them with the most optimal care based upon their precise clinical situation. Other members of the team include social workers and nutritionists and nurse navigators. Patients who have pancreas cancer go through a whole host of issues that are of great concern. We need to help them with their nutrition, we need to help them with social services, lots of issues involved, and we are able to offer that here at Stony Brook University Cancer Center. Despite the fact that the Whipple operation is complex, we have skilled surgeons with tremendous amount of expertise in performing the operation. We have excellent results. If you come to Stony Brook University Cancer Center, we'll take great care of you.